Hi, my name is Rachael and this is my audience. Over 50% of all fatal car accidents in the United States involving two or more cars and 65% of fatal car accidents involving a single car are alcohol-related. Americans between the ages of 16 and 24 make up almost 30% of all car-related accidents in the United States today, even with a blood alcohol concentration at low levels. I believe that I am qualified to talk to you about this topic because of the extensive research that I have done, and I, for one, have never gotten behind the wheel and drank alcohol. Driving involves a combination of a person's hearing, vision, muscle reaction, and self-control. But when alcohol is thrown into the mix, these abilities diminish very quickly. I will be discussing the effects of alcohol on a person's body, problems relating to driving while intoxicated, and finally, what you can do to prevent intoxicated drivers from getting behind the wheel. Alcohol has the ability to affect all the vital senses needed to drive. BAC, blood alcohol concentration, is the measurement used to evaluate the amount of alcohol in your blood at a particular time, says Juan, author of the 2003 article titled Alcohol and Driving. An individual's BAC level can be measured by a person's breath, blood, or urine. Your BAC does not reach its highest point until 30 to 60 minutes after you consumed your last alcoholic beverage. So this means you may feel fine at a party or a bar, but a few minutes into driving, you may be incapable of driving. As a person's BAC rises, their ability to drive decreases. Reaction time, attention span, and tracking abilities are a few of the many abilities that decrease even at the lowest BAC levels, says the U.S. Department of Transportation in the 1988 article titled The Effects of Low Doses of Alcohol and Driving-Related Skills. It has been found that the BAC level of 4%, the ability to judge distance and locating moving lights diminishes, which are both crucial for driving. At a BAC level of 8%, the ability to drive reduces even more, adding a lack of concentration and very slow reaction times. This goes to show that even at the lowest BAC levels, a person is not at the right state of mind to operate a motor vehicle, even though they may believe they are. A BAC level in a driver's is related directly to the number of accidents and fatalities in driving. Driving a motorized vehicle while intoxicated increases the chances of injury and, in some cases, fatality. The relationship between the use of alcohol substances and injury in a motor vehicle crashes is fairly well studied, says Sun, Anderson, and Schwab, authors of the 1997 article titled Alcohol Intoxication in Motor Vehicle Victims Associated with Hospital Bills. 1 in 7 traffic deaths are related to alcohol. In 1 year alone, 460 deaths, 2,520 serious injuries were caused by intoxicated drivers. This statistic shows that this is a very serious issue. Often, appropriate steps are initially taken in order to find a safe ride home, such as a designated driver. But over the course of the night, a designated driver may consume alcohol and not be able to judge when to stop consuming the alcohol in order to make it home safely. There is scientific consensus that the alcohol causes deterioration of driving skills beginning at a BAC level of 0.05% and even lower, and progressively serious impairment at higher BAC levels, says the 2012 article titled Alcohol and the Driver Created by JAMA. This study shows that even the slightest amount of alcohol can impair your driving. In order to reduce the rates of injury and fatality, we must take matters into our own hands. There are several steps that we can take as individuals and as a society in order to encourage and prevent the motor vehicles while intoxicated. One way that has been used in the past to prevent driving while under the influence of alcohol is rehabilitation. Results seem to differ on the offender's history of DWIs, with more positive effects for the first-time offenders, but for repeat DWI offenders, most research shows that the education and treatment programs have little or no impact on them, says Taxman and Picaro, authors of the 1999 article on preventing drunk driving, an examination of the rehabilitation and punishment approach. Another way to reduce the amount of intoxicated drivers is to make the punishment harsh. If the risk of injuring or taking someone's life is not enough itself, there are other options, such as fines, revoked license, and jail time. Studies have shown that drivers that have their license revoked still continue to drive, but drive in a safer manner so they reduce the risk of being caught. So, in a sense, the punishment is having an effect on the society. Mackenzie Olson, a student here at North Dakota State University, said during an interview on April 3rd of 2012 that she thinks harsher punishment should be set into place in order to create a bigger fear of drinking and driving while under the influence of alcohol. Driving involves a combination of a person's hearing, vision, muscle reaction, and self-control. But when alcohol is thrown into the mix, these vital abilities diminish very rapidly. Today I've talked to you about how alcohol impairs and affects the body's ability to drive, the problems that have occurred in the past due to a mixture of drinking and driving, and what you can do to prevent intoxicated drivers from getting behind the wheel. Use this information to help save a life. Thank you.